Welcome back to Mom in Mind. I'm your host, Dr. Kat. In our episode today, we are talking with Eszter Kalman. She is a mom of two who struggled with postpartum depression and anxiety, and she experienced the loneliness of motherhood after she moved to the U.S. from Hungary. She shares with us what becoming a mom as a new immigrant to the U.S. felt like for her, coming up against some cultural differences within her new family, as well as how that differed from her family and culture in Hungary. She shares a little bit how the loss of her mother prior to becoming a mother herself impacted her, especially as being an immigrant to the US where she didn't have any family here. She talks about the inner turmoil and the shame and guilt that came along for her in her postpartum journey, which ultimately led her into how she made meaning of her experience and how that supported her to go back to school, become a therapist, and help other people who might be going through the same thing. She's been a helpline volunteer for Postpartum Support International and Postpartum Health Alliance of San Diego for many years. Even though she was born and raised in Hungary and lived in Spain and in Italy, having lived in San Diego for 12 years, she truly loves her new home. She is able to enjoy the beautiful sunny weather of San Diego and now thinks it's the best place in the world. Let's meet Eszter. Welcome, Eszter. Thank you so much for being here.
Thank you for having me.
Um, yeah, I've known you for some time in and around the perinatal mental health circles, but I haven't heard your story. And I know that some of the things we're going to talk about are also related to and the immigrant story, your immigration story, and how that impacted you. So I know there are so many people that will be able to relate on some level. Um, so yeah, I'm really interested. Just have feel free to start wherever you'd like with your own story.
hmm So I moved to California back in 2011, and it was a very quick move. I was born and raised in Hungary. I lived in Italy, where I met my future husband, who is from California. And basically, after a couple of months of knowing him, I decided to move over here to San Diego, and I still live here. And it was first, it was just a major culture shock to me because it's so different
Yeah.
than where I was born and raised in every sense.
Mm.
So
Mhm.
first, I kind of had to get used to that, which took me years to really feel comfortable where I'm at today.
Yeah.
And okay, long story short, I moved here and things started to speed up. Within about a month, we got married, and a couple of months later, I was pregnant with my son.
So the time
Um,
frame from when you met him to when you were pregnant was about how long?
okay, so I met him in 2008, but I
Mm.
didn't really start talking to him and getting to know
Mm.
him up until 2010.
Oh, okay.
So then for a couple of months, everything was online. And then basically in November, we decided that I would move here to California, and we got married here in San Diego in January. And then I was pregnant, I think in August or September. So it was very quick. We
Hmm.
never really had like this dating period where you really get to know each other, right?
Hmm.
Which is so important. And we just never had that.
Hmm.
And my family was back in Hungary. They are still there.
Hmm.
I lost my mom back in 2006, so I didn't even have her in my life.
Oh, okay.
And my husband, he's from a Mexican American family. His family was living in a different city as well. And it's
Mm.
even that experience, which I can talk about later, that the cultural differences
Hmm.
in terms of the culture of the family, how that really impacted me when I became a mom.
Yeah, yeah, yeah. Yeah, all of
Um,
that's so important. Hmm.
mhm. And so I got pregnant really quickly, and 9 months later, I just had a baby.
Hmm. Hmm.
and and I had an easy pregnancy, so I was very lucky. I didn't have any issue with that. but just like probably many moms, I really thought that it's just going to be almost like a piece of cake, a walk in the park. What's the big deal? I'm just going to have a baby. And
Right.
maybe because I don't know, I was not educated on it. I maybe I didn't really want to face the reality of motherhood, or I didn't know what it
Mm-hmm.
would entail of. Um, it was a shock. And
Mm.
it started actually with my birth, um, because when I went into labor, so my husband's family is he comes from a very different like culture. His parents, his siblings, they see family very differently. Like they are very involved in each other's lives, or
Mm-hmm.
at the time they were. And his mom had told us that, oh, she's going to come down to help. And I should have listened to my gut feeling, because by then I had a chance to get to know them, and not that there's anything, bad or good about them. It's just very different. And I
Mm.
think when you're pregnant, when you're a mom, it's so hard to set those boundaries and
Oh
just be
yeah.
able to say no when you know it's not going to be the right help. And I didn't do
Mm-hmm.
that. I wish I
Mm-hmm.
had done it.
Mm-hmm.
And basically I was in labor. You wanted to say something.
Oh no, I was
Oh.
wondering, yeah, thank you. That like the difference in culture in terms of your family of origin, or even like the culture of Hungary, is our
Mhm.
families not as like involved in the same way as your husband's family was?
Um, they are involved, but there's more privacy.
Oh, okay, got
So
it. Mm-hmm.
they honor more privacy than,
Mm-hmm.
let's say, than my husband's family, or
Okay,
the culture of his family.
sure. Okay, yeah,
Um,
that was my question. So thank you.
yeah, and 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 then I went to take all those birthing classes, and I remember not one time they would mention about postpartum depression or postpartum anxiety or any mental health
Mm-hmm.
changes in that period. Um, and when I went into labor, uh, I remember that same day my husband had to work, and I was home alone with my mother-in-law. And I was in the bedroom, just laying down on the bed. And I don't even know why I'm smiling at this, because it was so sad. And for and it's scary, especially when it's the first time. It's really
Right.
scary. It Obviously it's painful. I didn't know, no matter how many classes I took, I didn't know what to do. And I was just there laying down, and I remember that my mother-in-law was in the living room
Mm-hmm.
on the phone, and for 8 hours she wouldn't come in and check on me, not one time. She knew I was in labor, she knew I was in pain, and she didn't check on me.
Mm-hmm.
um, and it just felt very lonely and
Yeah.
scary.
Yeah.
And I had nobody else there, and I thought I would have somebody there to kind of help me with that, especially that she did have 5 kids.
Mm.
So
Mm. Mm-hmm.
and then anyways, my husband came home, we went to the hospital. Then even there, just hard time setting up boundaries, saying what I needed.
Mm.
um and
Like from
I
hospital staff,
Yes,
or
yes,
oh, okay.
yes,
Mhm.
yes, yes. Like I know I was just so scared, and everybody was just, just not even really explaining things to me, just telling me what to do. And when English is your second language, and I just literally moved to, or a year before that, I moved to the US. So that was
Yeah.
the first time when I went to a hospital
Right.
here,
Right.
right?
Right. So you're in labor and dealing with all of these really new things, new language,
Yeah,
new processes, new stuff. It's a
yeah.
lot.
And then plus dealing with, the help, what I was hoping I would get from, my mother-in-law, which I didn't get.
Hmm.
And then my husband was there in the hospital, but he really didn't know what to do. And I still remember when the when I was ready to deliver my son, and then the doctor wasn't there, or they were waiting for the doctor, and the nurse told me to to put my legs down and not to push,
Mm.
like hold it back while the doctor gets there. And thinking back, I remember I did that. I remember that it was a horrible feeling, because
Yeah.
obviously it's such a crazy, strong pressure. You
Yeah.
can't possibly hold it back. And
Right.
it was the worst, the worst feeling. And it's almost like, like you just want to like do what you're told to do, because you're scared to speak up, basically.
Right.
And
Right.
but then, the doctor came, my son was delivered just fine. It was all good. And then when I went home with my son, I guess that's right away, my anxiety kicked in. I don't even think what I had was baby blues. From the get go, it was already
Mm-hmm.
postpartum depression.
Mm-hmm.
I really didn't feel supported at home, and it's
Mm-hmm.
so important. Um, I just had a bad experience, honestly, with in the first couple of weeks.
Mm-hmm.
I was cooking, I was doing the laundry. What it was like for me in the
Absolutely.
first 2 weeks, when you don't have any family here, I didn't have my mom, I
Mm-hmm.
didn't have my family, and then the people who were there or were supposed to be there for me to help me, um, they were not there for me, and I had
Mm-hmm.
to cook for her. I had to do her laundry. Uh, Even when I remember she made some. Still remember that. It's crazy how that works. One
Yeah.
morning I woke out, and then I woke out and I see her cooking in the kitchen for her son breakfast. And I asked her, like, is there anything for me? Like, I'm a breastfeeding mom who's
Mm-hmm.
up all night. And she said, oh, I didn't make it because I didn't know if you liked it or not. And that was all, you know.
Mm-hmm.
So anyway, that was only 2 weeks. And then after that, I still didn't have any friends, because
Mm.
I was brand new.
Yeah.
I didn't have any family. I had my husband, but he was working all the time. And I was just alone with my son every single day, and it was horrible. Uh, it
Yeah.
was it was just bad. I didn't have any friends. I'm new to this country. I'm even new to my marriage, because
Right.
it's a brand new marriage. I'm new to his family, and I'm a brand new mom, and I don't have my mom. And even at the time, even though I didn't know like how that could be also risk factor
Mm.
for postpartum depression, but I could just, every day I would think like, oh, I wish I had a great relationship with my mom.
Mm.
So I was just thinking that I wish I could just call her, just to talk to her, not even asking questions, just to have make a phone call and just hear her voice.
Of course.
um and yeah, it was just very lonely. Like, nobody brought food, nothing. It was just me and my son, and it was bad. I didn't enjoy that first year at all.
Mm-hmm.
And I remember there were days, like 5 days straight, when I wouldn't even leave the house. I would take care of the baby.
Mm.
So fortunately, I wasn't as depressed that I wouldn't even get out of the bed. But, I would take care of him. But that's it. It was just like a to-do list that I
Mm.
have to,
Mm-hmm.
check that box. And yeah, and then this is how I like to explain it to this is how I explain it to my clients, that I knew I loved my son, but I didn't feel it. Like, that's what
Mm-hmm.
postpartum depression was like for me. I knew I loved him, but I just didn't feel it. I didn't enjoy anything about it.
Yeah. That's incredibly difficult. I mean, being so isolated. Um, and not even knowing necessarily, when you drop into, even if you're moving from one city to another city, it takes a long time to
Hmm.
even know where your favorite grocery store is, or anything that you even like in that area and to not have even some basic stuff familiar to you? Like where do you go to find any comfort?
You just don't find any comfort, or I didn't.
Right.
Um, it was just surviving every single day. And even and I have so much, so it's so interesting like how I have memory losses, or I
Mm.
can, from the first year. I
Yeah.
remember, but sometimes I look at a picture and I'm thinking, oh, I don't even remember this, that we did that or we went
Yeah.
there, because
Yeah.
I was just like in this, I don't know, zone. Um, yeah, it was really not a good experience. It was lonely. I didn't like it. I didn't have anybody to talk to, and I didn't feel supported uh, by anyone, to be honest.
And did you at that point did you know what was going on for you? Like did you know that it was depression or anything like that, or did it just feel horrible and you weren't sure what was happening?
I didn't know what was going on. No, not at all.
Mhm.
Um, it, I just thought that that's what motherhood looks like for me, at least.
Mhm.
Um, I know even if I left the house, I would also fall into the um, trap of comparing myself to other moms. The playground. I remember I was so bitter, and even when I saw that another mom was pregnant, or a friend was pregnant that I from Hungary, I know I was not happy for them. I was not
Mhm.
even I was thinking, why would you do that? Like you're
Mhm.
ruining your life. And on the other
Mhm.
hand, I was jealous that they were actually enjoying it, enjoying
Yes.
something that I wasn't enjoying, but I wanted to. Um so
That
yeah,
is so real. I mean, I'm just as you were saying that it's such a horrible feeling, but it's also such a great way to describe what it feels like.
yeah, I
Um,
was jealous. Yeah.
for sure. Yeah, jealous and like longing and
Hmm.
not understanding why other people are doing it and not feeling connected. There's so many people that feel that way for different, a lot of different reasons. But in some ways, as you're describing what you went through, the kind of odds were stacked against you for being
Hmm.
able to have a different experience because everything was new and you didn't feel supported.
Yeah.
So like given that, were you like how did that work? Were you able to even describe to your, let's say, your husband how you were feeling or anybody even back home? Um, did you have any words to describe it?
Well, with my husband at the time, I remember it really negatively impacted our marriage. So he was working a lot because, we had to pay our bills, the rent, and he was tired because of that. I was tired because of the baby. And it was mainly, I mainly fighting, arguing, but also I didn't feel comfortable telling him, on one hand because of the relationship that we had at the time, and on the other hand because it was I was ashamed. Like I
Mhm.
felt like that if I was going to tell him how I feel, then it would be an embarrassment.
Mm.
And it's embarrassing that I feel the way I feel. Or he would say, just shake it off. Or I had actually comments like that from some of my family members in Hungary,
Mm.
that they I kind of expressed them how I felt, and the immediate response was that, oh, then you shouldn't have had a baby if
Oh.
you felt this way, or if
Mm.
I felt this way. And
Oh,
that's
you
very
can't change.
invalidating.
Yeah, you can't change it at that
Yeah.
point if you had
I know,
known.
too late.
Right.
Yeah.
So I know before, we kind of started going on this conversation, we had talked briefly about the cultural differences in Hungary versus here, just in terms of understanding perinatal mental health stuff. So that like the comments that you were receiving was coming from family members who don't know really anything about perinatal mental health, I assume.
Yes, no, absolutely not. Just close family members, I didn't know anything about perinatal mental health either.
Hmm. Hmm.
But the fact that, when you try to confide in someone and that's the response, that you shouldn't have had the baby, or just, push it through. Um, yeah, it was, and especially that I didn't have my mom, because it was
Hmm.
another like woman family member who told me that.
Mm.
And yeah, it was very invalidating, because I was hoping to find that comfort in her that I would have found in my mom, but it didn't happen that way. However, the one comfort that I found here, that there was this nurse uh, who came to visit uh, us like once a month, like doing home visits, just to check on the baby, if he's developing well, and check on me. And I remember her name was Sotia, and she was super nice. She was the sweetest, nicest person. She was fun. She got along with my husband too, and and I really felt comfortable with her also, because like, she, beside from being nice, she would keep uh, visiting us over almost like for about a year, I think. And I
Mm.
felt the most comfortable with her. And I know she would do screenings on me, and I would just the self-administered screening, like the Edinburgh scale for postpartum depression. And that's when thinking back, I realized, like, all these scales are so pointless if the person, the mom, the parent, doesn't feel comfortable with the provider who's giving them this test, because I
Yeah.
just lied
Hmm.
initially, and it
Hmm.
took me about a year to really admit, not just to her but to myself, that okay,
Yes.
something is wrong, because it starts there.
Right. Yeah, absolutely. Which
Oh, and
also feels like more isolating because you kind of
yeah,
know you're not being truthful,
yes,
like to somebody else because you don't want to admit it to yourself either.
yeah. And this just reminded me of my OBGYN, which was, the 6-week visit,
Mm.
follow-up visit.
Hmm.
So my doctor, wasn't there at the birth because she was not on shift or on call, which is fine. Uh, but, I went to see her like throughout the 9 months. Like, she would see me growing my belly, and just getting to the 40th week. And I remember when I went back for my 6-week follow-up, my son was sleeping in the little car seat. I just put him down next to the chair, and she came in to examine me, and the whole visit was just like 5 minutes, and and everything was fine. But what stuck with me, that she didn't even look or ask about my son, my baby, my birth, nothing. She
Mm.
just came in, checked, what she had to check, and she left. And
Wow.
it just felt so like impersonal, because that's what
Mm.
it is, and
Hmm.
just
Hmm.
beyond rude or mean. It's just like, like, well, you would think that if you're in the helping profession, like, you would want to create some relationship with your patients. And if you see a
Right.
mom for 9 months, at least you would look at her baby, or just ask about the baby, and
Right.
nothing. I just, yeah, it stuck with me. So I never went back to her after
Oh,
that.
good. Good. I'm glad you didn't. It's like you're invisible and your son's invisible.
Yeah, yeah. That
Oh,
that was, fortunately, with my daughter. My doctor was amazing, so that was a
oh,
whole nother story.
okay. Good.
But going back to the nurse, so because of Sochi, after about a year, even though I kept lying on that Edinburgh scale, I remember, like, after about 12 months, my son was more than a year old,
Mm.
when I was alone one night, and I sent her a text message, because that's how good our relationship was, that I would have her cell phone number. And I remember I just messaged her that, hey, I'm just not feeling well. But I didn't even say anything about depression because I was so ashamed of saying that
Mm.
word. I just
Mm-hmm.
said, I don't really feel well, like it could have been a cold or anything.
Right.
But I just like, I don't feel well. And I think maybe I need some help. And
Mm-hmm.
just to show how connected she was, thinking back, she knew exactly what I was talking about. So she
Mm.
just sent me back some resources, the Postpartum Health Alliance of San Diego, and that's how I got connected then later on to a therapist.
Mm.
And 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 that just changed my entire life for the better. After
Oh.
the first visit, it was so amazing. Like, well, she didn't really do anything special, just listen to me, and she just heard me out, and I didn't feel like I didn't feel like there was something really wrong with me or I was
Mm-hmm.
a bad mom. And all she
Right.
did was just sitting there and just listen. And that was the highlight from that point on. The highlight of my week was always every Friday when I went to
Mm-hmm.
see her. Yeah.
Mm-hmm. Oh, right. It's also the first time you're really like being seen. Like
Yeah.
somebody else understands what's going. Like you're not alone in it anymore. Other than
No.
with Sochil, it sounds like
Yeah.
she
Yeah.
was really in tune with you.
Yeah. No, she was amazing. Really. It's just like someone listens to you,
Hmm.
and you just feel like a normal person again, because that was new to me. Like that was probably the first or the second time when I went to see a therapist in my life.
Hmm.
So the whole situation was new, but yet I always felt like, oh, she's so nice, but in a professional way. I always thought that. But yeah, and that point and on, it just my life just took like a 180, and after a couple of months, I just started feeling better. Um, because I was seen, like you said, I was heard,
Hmm.
um, and then that's when I started thinking about, okay, what should I do next? Because I didn't want to go back or just stay in the. Didn't want to do the same thing that I did before in terms of work,
Hmm. Hmm.
and that's how the whole idea of um, going back to school and getting my master's to become a therapist, what I am today. So that was.
Amazing. So the therapist you had was trained like a perinatal mental health
Yes, yes, it
therapist.
was. Yes, it was through the Postpartum Health Alliance of San Diego. So yeah,
Hmm.
she was trained in that, and she was amazing. Yeah, she's great.
So, I mean, right, like so many of us who come into this profession come into it from some through some kind of suffering first and realizing how much we didn't know. Um,
Hmm.
but you, if I can go back for just a second before we like come back to what you're doing now, um, you, you were because I think the cultural piece is really important too about like where you in Hungary, where you came from, there's no real discussion about mental health, right?
No, not really, or not at the time.
Not
Maybe
at
it's
that
a little
time.
better now, but still, it's in baby shoes.
Uh-huh. Yeah. And then coming here too. So it's just like there's so many layers that you had to work through too of just like understanding the mental health part of it, um, let alone the transition into motherhood. So in your process of learning, I mean, there's just so much, guilt and shame and misunderstanding about what mental health is. So like when you first started to realize that maybe you were depressed or whatnot, what was that like for you, from a cultural perspective to understand that that's what might be going on?
Hmm. Well, because like I said, in Hungary, it's so not talked about mental health in general, but especially maternal mental health. I didn't even tell my dad or anyone who I knew in Hungary that I'm seeing a therapist. I don't even think here in even here in the US, only maybe just my husband knew it and one of my best friends.
Mm.
And that's on. So that was also attached to it. I would always tell the people like, oh, I have an appointment to go to.
Mm. Yeah.
I wouldn't say like, oh, I'm gonna go and see my therapist when you say if you go and see your OBGYN or your doctor, right? That's not a
Right.
problem to say. And so that cultural piece really stuck with me, that
Mm.
we don't talk about that. Um, and even though I saw a therapist, I wouldn't really talk about it openly. But it
Mm.
took me years. Honestly, just that's why I always say like postpartum depression or just perinatal mental health is the sneakiest
Mm.
uh, illness that exists, because even though after you are healed or you start feeling better, um, the guilt piece just time to time just like pops up.
Mm.
Even in
Mhm.
these days, sometimes, like I said, like there are pictures that I look at and I don't even remember that we did
Mhm.
that, or what it
Mhm.
felt like at the time to be there or doing something with my son. And it just popped the little tiny bit of feelings of guilt, like, oh my gosh, like it's horrible that I felt the way I felt, even though it wasn't my fault. I know that. But uh, it just, there's a little guilt that, oh, I wish I could have done differently, or I wish it would have never happened to me, or if I had reached out for help sooner and
Mhm.
not after a year. So it always just kind of sneak up on you. And even after I became a volunteer, like years after I became a volunteer for PSI and Postpartum Alliance of San Diego, it's crazy. It almost felt like that I was wearing a mask the whole time, that
Mm.
everybody knew that around me. I knew that they knew
Mm.
that probably I'm here and I'm a volunteer because I experienced something like that. But I never openly talked about it. And that, not that you have to, but I felt that I was I wasn't really genuine. It wasn't the real me.
Mhm.
And I just, and I that piece, cultural piece from Hungary was with me, that
Mhm.
while I'm a volunteer for PSI, I'm helping other moms. I'm a therapist and helping other moms, but I'm not gonna share my own story publicly. And just about a couple of years ago, I think PSI had some initiative on like a not really initiative, but they just organized something on social media and they were looking for people to share their stories. And then
Mm.
I said, okay, I'm going to do it now. And it's just like when you break the glass ceiling, it was just
Mhm.
so good. And after
Mhm.
that, I'm talking about it everywhere now.
Right. Mhm.
And it just, once you start talking about it, you realize that there's nothing embarrassing about it. It's the opposite.
Mhm. Right. I'm so glad you said that. It is really hard to break through that, with that shame and guilt and I don't know if it felt like empowering for you to not have to hide anymore.
Yeah, very
Uh,
empowering. Yeah, you
mhm.
just feel like that I think when you get to that point, that's when you can really maybe say or feel that you are healed. When you can just openly talk about it,
Mhm.
even if it's not so publicly on social media, but just like
Mhm.
openly, maybe in your with people who you trust, and you can tell them.
Yeah.
That's what it was like for me.
So that, I mean, all of that then took you back to school. I mean, obviously your experience took you back to school, and now this is what you do.
Yeah. Now I'm really, I do what I love to do the most.
Mm.
And I'm glad I went back to school. Though I remember in school, you know how you often have professors that are just teaching but not actually practicing. And I
Mm.
remember in school, just to going back to the previous piece, in school I remember some of my professors, they always say like, no self disclosure, only if it serves the client, and
Mm.
even then be very careful. and And I remember when I went to see my therapist, I asked her, I wanted to know if she did experience or if she had experienced postpartum depression or postpartum anxiety. And she did answer. She did give me a hug after the sessions,
Mhm.
which in school, it's a big no. You don't touch
Mhm.
your clients.
Mhm.
And and it just took me back there that how much school can be so different from reality, especially in the world of perinatal mental health, when
Mhm.
it's such a like a vulnerable period and such a very difficult, hard period of that parent's life, that all they want to know if you can relate. Not
Yes.
necessarily you share all your story to all the details,
Mhm.
but they want to know if you understand what they are going through. um so that was
Yeah.
also another piece from school that, yeah, sorry, go ahead.
No, I was just going to agree with you on all of those points. It's really true. I find that to be true for supporting this population, perinatal mental health. That it's almost like, and I'm sure you've experienced this, like maybe as yourself, but also as a therapist. Like once they know that they're
Hmm.
not alone, in just speaking with you, it's like shoulders drop, the tension is released. Like it's so much easier. Again, like you said, not you don't even have to tell your whole story, but there's just so much vulnerability in a transition into parenthood. Um, just, I mean, historically, there's just so much pressure too, and we're still feeling it, even though we're like, we can sit here and have an open conversation.
Hmm.
There's still a lot of silence and pressure. So yeah, just that knowing that the person you're talking to isn't going to be sitting there and judging you is a big deal.
Yeah, I think it's so important to, when you as a therapist, you can just kind of sense it, even if the client doesn't ask you straight up,
Mm.
but just to give them a little bit of piece of you, like be a human, right?
Yes.
And a person, and not this blank canvas that
Hmm.
often, therapists are taught to be that way in a therapy setting, when it's all about the relationship. It's all about how you can connect with the person who's sitting in front of you. And I agree with you, when they see the person, the vulnerable person in you, the human in you, who also struggled maybe in the past,
Hmm.
then they feel safer to open up as well.
Yeah. Yeah. It changes I think the inherent power dynamic a little bit
Hmm.
too from,
Yes.
ugh, so you're not just feel like you're being observed um, as a client. So now with all of the work that you've been doing, yeah, how has this manifested for you in terms of the work you are doing now?
Well, right now I see clients in my private practice, and beside from seeing my parent clients, I also love to create educational materials online, on social media, on this topic, on perinatal mental health. And uh, and since I'm from Hungary, and we talked about how in Hungary it's even less talked about than here in the US, that's what I also started doing, creating lots of educational content on this topic in Hungarian as well. Um, YouTube or on social media. I'm about to start a Hungarian podcast that's similar to Mom and Mind. Hopefully, in the future,
So
I can
cool.
say that that I
Yes.
have the Hungarian Mom and Mind podcast. But I named it "A New Mom is Born" in Hungarian. That's what it's.
Oh,
Új anya születik. Yeah. Um, so that's what I'm working on. I'm also working on, in English and in Hungarian, to create something that would have helped me a lot when I
hmm.
was pregnant with my first child. Um, how to prepare, not just like how to prepare for the postpartum period, but not the
Mhm.
way they teach you in the birthing class, like how to change the diaper, but really like emotionally, socially, like your emotional health, your social health, right? Like who to surround you with and how to figure out who's helpful, who's not. Because sometimes people have the best intentions and they really want to help you,
Mhm.
but it doesn't mean that you perceive it as help, because that's not what you need, and how to figure that out.
Right.
um so there's so the all social, emotional, and mental health perspective of postpartum planning. This is what I'm trying to create a course, or in Hungarian, and as well in English.
It's amazing and so needed. It sounds like both from like within the language. It's, as you probably know to some extent, that like hearing it in your native language is different. It hits different. Like it just hits different emotional stuff. And if you had, like you're saying, you're creating something you would have needed and wanted.
Yes, and I like you said that in your own native language, because when, just to bringing back the cultural piece to it, when I started creating content in Hungarian,
Hmm.
it felt awkward, because the
Yeah.
shame just a little bit, like I
Mm,
was thinking, oh my gosh, my friends are gonna know, my family's gonna know, because
yeah.
I knew I had to do it in the same way I do it in English, just in Hungarian. And I had to kind of break through those barriers and that feeling of shame around that, because I knew I had to take the mask off, not just in English, but
Mm,
also in Hungarian, and talk about it openly, not just the topic, but also my story as well.
right. And I imagine you're one of very few people talking about this, like in Hungarian. Maybe
Yes.
you're connected with some people who are, but I can't imagine there are that many people. So you're also the first, or one of the first at least, to do it.
Yeah, yes, and fortunately I have some good friends in Hungary, and they actually encouraged me. They started to tell me, why don't you make these videos in Hungarian as well? Because it's
Mm,
in English, but it's nobody talks about it. They always say nobody talks about it, or not as openly as I do.
mhm.
And that really just motivated me to let's do it. I'm gonna be famous in Hungary about
That's
talking.
awesome. It's so needed. I mean, right, this is that's sort of what I love about this specialty is that you have your experience, which in some ways overlaps with other people's the feelings, the symptoms, and
Yeah.
that sort of thing. But like the immigrant experience is a whole other layer. Um, but you, through your own healing, you're able to provide something for other people where a resource does not exist. Like
Yeah.
unless you have found something in Hungarian talking about perinatal mental health openly, then you might be the first. And that can change culture. That can change people's lives.
Well, I hope I can really just, help any moms, but in Hungarian, obviously, lots of Hungarian parents. Sometimes I get um, messages in Hungarian, not just from moms that are currently moms, and they just say that, oh,
Mm,
thank you for talking about it, because I wish they had told me this or that. But I get messages from grandmas in Hungarian saying that, oh, you know what? 40 years ago, I
wow.
did go through this and
Wow.
nobody talked about it. And
Wow.
that's when I get goosebumps,
Yes.
because it just shows that, like, healing is never too late. Just because you're
Yes.
70, 80-year old grandma now, but you
Hmm.
had a traumatic childbirth or a horrible postpartum depression, anxiety experience, that
Right.
doesn't mean that it's too late to process that and heal from it.
Absolutely. Oh, I'm so excited that you're doing this. And I'm excited for the people who are going to have this resource now.
It's really about, to me, like, when you were talking about like, creating the in Hungarian or in English, the whole educational pieces that um, it's really about the meaning making, right? What's the goal in general? I think in therapy, any therapy, that how you kind of process your trauma and turning that into your purpose, just kind of
Mm-hmm.
make sense of it and just finding that meaning making that really just helps you find a purpose in life. Well, the hopeful message, I think it's for all moms, immigrant or American born, US born, Hungarian, it doesn't matter. It's really just to the sooner you realize that asking for help doesn't mean that you're weak, but it means that you just want to remain strong, the sooner you're going to feel better.
Mm. Yes. Yeah. Thank you for that. And I want to also, as we close, for now, I want to make sure everybody knows where to find you. And you can be found everywhere through Golden Tears Therapy. That's on your website and Instagram and YouTube. And where else are you?
Um, I'm on TikTok as well.
Oh,
That's
nice.
Golden Tears Therapy too. On my website, there's this downloadable English, free English postpartum plan that anyone can download. So, and that way, or if they just follow me on any of the social media accounts, that way I can keep everybody posted on the upcoming little webinar that I'm putting together in English and in Hungarian about how to really prepare for the postpartum period, so it's emotionally and mentally is not as difficult, hopefully.
Right. Great. I mean, you're creating such a beautiful new resource for people to listen, whether they live here or wherever they live and they speak Hungarian, they can listen and hopefully feel heard and seen in the way that you were eventually and need to be.
I have a Hungarian Instagram account where I post all these materials, and that is új anya születik, which in English actually means that a new mom is born.
Mm.
So új anya születik in Hungarian on Instagram.
Oh, beautiful. So thank you so much for sharing your story here and for all of the work that you're doing now.
Thank you so much, Kat.
Again, you can find Esther at goldentearstherapy.com, on Instagram, YouTube, and TikTok at Golden Tears Therapy. Please do share this episode with anybody who you know that might be Hungarian or knows somebody who could share this episode with anybody that they know living in Hungary who needs this kind of support or may be able to share it with somebody who does. Thank you for being with us. Until next time.